Hi, my name is Dr. Alex Lipczynski, and I'm a double board certified facial plastic surgeon. In this educational video, we'll be showing some intraoperative photos and video of a mid-facelift. We will also look at some before and after photos of patients who have had mid-facelifts. In this intraoperative photo, we see that the incision for the mid-facelift is made in the temporal hairline. The yellow arrows show where the incision is made, and the black arrow shows a suture that's been placed into the malar fat pad for elevation of the midface. In this second intraoperative photo, we see that an incision is made under the lip in a subperiosteal plane connecting the temporal incision. The yellow arrow shows the subperiosteum or the maxillary bone, and the black arrow shows the incision. This will connect to the temporal portion of the incision. In this intraoperative photo, we can see that the periosteal elevator that's used to make the dissection in the subperiosteal plane has been passed through the temporal incision and brought out through the sublabial incision. This means that both incisions are connected in the subperiosteal plane. In this intraoperative photo, the black arrow shows where this permanent suture has been placed into the malar fat pad to lift the midface. Once this has been performed, the permanent suture is sutured into the temporalis fascia for permanent elevation of the midface. Then the temporal and sublabial incision are closed. This intraoperative video shows me pulling on the permanent suture, and as you can see, there's an elevation of the midface, but not only the midface, but the jowl as well. A good midface lift should lift the malar fat pad, midface, and some of the prejowl sulcus. This is a before and after of a patient who had an endoscopic midface and forehead lift. As you can see, her forehead muscles have been nicely reduced, and her midface has been lifted up from the three-quarter view. The second case is also a patient who had extensive malar fat pad ptosis after a midface lift. We can see that the malar fat pad and midface is nicely reapproximated. In this case, the patient had a combination of a minimally invasive lower facelift as well as a mid-facelift, and you can see the periorbital and submalar and malar and cheek rejuvenation has been nicely achieved. This patient also had a combination of an endoscopic forehead lift and a minimally invasive facelift procedure, but also a mid-facelift, and we can see the periorbital area has been nicely rejuvenated. The malar fat pad has been lifted up into place. And the last case shows a patient who had a combination endoscopic forehead mid-facelift as well as a lower facelift that has nice rejuvenation in the periorbital and the malar area. This concludes the educational video for the mid-facelift. I hope you have enjoyed this video. I thank you very much for your attention.